Hello, and welcome to the Vulnerable Populations Lucid Chart. The American Journal of Managed Care defines vulnerable populations as those at greater risk for poor health status and decreased access to health care. Vulnerable populations encounter barriers to accessing healthcare services. Vulnerable populations can be divided into three categories: physical, psychological, and social. Examples of vulnerable populations attributed to physical needs include high-risk mothers and infants, the chronically ill and disabled, and persons living with HIV and AIDS. Chronic medical conditions can include respiratory distress, diabetes, hypertension, dyslipidemia, and heart disease. Vulnerable populations related to psychology include those with chronic mental conditions, alcohol and/or substance abuse, and those who are suicidal. Socially, vulnerable populations include those living in abusive families, poor education, homeless, immigrants, and refugees. The 6 risk factors for vulnerability that I chose to discuss are chronic disease, mental illness, homelessness, drug and alcohol abuse, poverty, and poor education. Chronic illness are significantly more prevalent among low-income and other disadvantaged populations. The chronic disease burden is concentrated among the poor. Poor people are more vulnerable for several reasons, including increased exposure to risks and decreased access to health care. Chronic diseases can cause poverty, and poverty can potentiate chronic diseases. Mental illness. Mental illness sufferers are vulnerable as a result of the way they are treated by society. They are subjected to stigma and discrimination. An overwhelmingly majority of people with mental and psychosocial disabilities are living in poverty, poor physical health, and suffer from substance abuse. Homelessness. There is an obvious connection between homelessness and poverty, but homelessness can also be a result of or contribute to mental illness, substance abuse, and chronic illness. Additionally, homeless people might have a hard time getting health care and services. Drugs and alcohol abuse. According to the World Health Organization, over 21 million Americans struggle with a dependence on drugs or alcohol, and less than 2.5 million receive treatment at a special facility. Substance abuse can lead to or potentiate mental illness, homelessness, chronic illness, poverty, and or decreased opportunities for adequate education. Additionally, substance abuse may be a result of suffering from one or more of these vulnerabilities. Poverty. Adults with low incomes were more likely to delay or not receive necessary medical, dental, or mental health care, and they were less likely to refill prescriptions. This affects the outcome of chronic diseases and mental health conditions. Many people living in poverty may turn to drugs and alcohol as a coping mechanism. Poverty may decrease the chance for adequate education. Similar to the homeless population, basic needs like food and shelter are usually a priority over health care. Poverty may be a cause or result of many of the other vulnerabilities. The poorly educated. Lack of education increases a person's risk of suffering from other vulnerabilities. According to the World Health Organization, patients with a chronic illness who have less than a high school education are 3 times more likely to report being in poor health than those with the same illness who go to college. Chronic illnesses are significantly more prevalent among low-income and other disadvantaged populations. These categories are not mutually exclusive. They are all interrelated and are likely compounded by vulnerabilities in other categories.